Yet Bine. Good morning, everyone. Thank you for joining for our second year anniversary. We're, I don't know, amazed that we're at this point. 2 years ago, I would not have thought that I would be working on COVID relief full time. Would not have seen that in my future. And I'm sure that the women here with me can agree. Incredible to have been able to play the role that we've been able to play in providing protection and relief to our people in the face of the ongoing pandemic. So, but we're all going to introduce ourselves, and then we're going to talk a little bit about the programmatic work that our teams have done over the past couple years. She'e Branchen Shafi Putwatni Nishlin Nakai Bashis Chin Sinajani Dashache Do Nakai Dashanala. I'm speaking to you from Quintana in my office here. I have my manager here with me today, and I'm going to hand things over to our deputy director.
Good morning, everybody. Thank you for joining us today on this exciting day of our second anniversary. As Ethel mentioned, I'm the deputy director, and Cassandra. I'm Sitnajini and Twatachitni. I'm originally from Tuba City, Arizona. And my father's side, I'm Nigerian and British and Irish. And it's been an honor to be in this role. Super excited to be here to talk about this anniversary of events. And so again, welcome and thank you for joining us today. I will go ahead and pass over to Mary Frances.
Abine. So Sheya ye idine tachini nishlan ado tabaha pashichin logat dashiche and Zatlana Dashanella, and I'm the direct relief program manager. So I'm very glad to be here. Thank you for joining us this morning. I'm gonna go ahead and hand it off to Wendy.
Good morning, everyone. My name is Wendy Atsidi, Todachini Naslido Ashin Bashischin. My family is originally from Herfano, so that is in the New Mexico side. And I'm the public health education program manager. And good morning, everyone. And thank you for sharing this day, our anniversary day. And I'm going to pass this over to Shondine.
Good morning. She'e Shindin Herrera Nished, Tachini Nishlin, Nakai Bashishi Pitani Dashache, Nakai Dashanilla, Auto Tabins Sky Danasha, out a Danet on Nishle. My name is Shindin Herrera. I am currently the director of the Tabins Sky Community Center in Monument Valley, Utah, which is our inaugural community center. I started with the Relief Fund as one of the co-founders, moved to the board for a while, and then moved over to our community center work. So it's been really great to kind of have this overall experience, and really excited to kind of share some of that with all of you today. Thank you, and I'll give it back to you, Ethel.
Awesome, wonderful. Thanks, Shondine. Well, this panel is all about the programmatic work. As you guys know, things have kind of shifted over time for us. We had what we call the phase 1 response, which started March 15th of 2020. And that was really focused on our kinship care package program, where we were getting food, water, and PPE, 2 weeks worth of those items to families on Navajo and Hopi. And that lasted for over a year. And we wrapped that up in early July. And then we also had our PPE delivery system distribution program that operated from November of 2020 until we wrapped things up in July, essentially. So that was kind of phase 1. We also had our public health education program ongoing during that phase. And then phase 2 has been all of the recent stuff. The isolation kits, mobilization of our PPE program, continuation of public health, sharing of public health information, And then, of course, also the very important vaccination campaign that we've had underway through our public health education program. And then we launched our community center in April. So, but I'm going to hand things over to Mary to share the details of the recap on our kinship care package program, as well as some insights on our isolation program and our Clean Hands project.
Thank you, Ethel. Okay, so I'm going to go ahead and share my screen. And here I have, let's see. So I have a presentation put together, doing business as Navajo and Hopi families COVID-19 relief fund. And this is for 2021 and to 2022. So this is information on the kinship care package. We initially had this program going, at the beginning of 2021. So we were providing services for about 5 months into 2021 with the kinship care packages. And so in total, we have served 28,683 households, and that is over 73 communities. And with the breakdown, we're able to serve 3,390 Hopi households, and 7 of those, 7 of the communities were able to serve. Then with the Navajo households served, we were able to serve 25,993 and with 66 households. So let me see if I can say this number in Navajo. So the 28,683 is Nadine Sebi de Miliage Dobaan Hastadine Zadin Adot Sebitin Dobaan Ta Eya Baka Ije Koho Hawaniki. Let's see, community Ziki. Tosidin Dobaan Ta Eya Baka Ije. Ado, the holiday food boxes is another initiative that
Hey,
we.
Mary, I have a question. So
Yes.
that was just our performance for Kinship Care Package Program 2021. So that doesn't capture the full scope of that program. Can you share how many households were served since inception, since we started work through the end of May 2021?
Since the inception of May of 2021 for the direct relief program?
No, since the beginning of the Kinship Care Package Program.
Oh, okay. So since the beginning of the.
Share with people kind of like the broader perspective on the performance our programs have done over the last 2 years. And that was just sort of like the tail end of the first year.
Okay.
Okay, if you don't have that number handy, that's over 80,000 households. Just so folks don't get confused and think that we only serve 25,000 households for that entire program. So that program started basically when we started as an organization. I think we had our first distribution on March 18th, and it is running pretty strong for all the way through May 2021. And during that time frame, that's when we served the over 80,000 households. So. Okay, that was it. I just wanted to make that.
Okay. Yeah, I apologize. Yeah, those numbers I have in another location, so I apologize for not having that. Let me go ahead and reshare my screen. Okay. And then for the holiday food boxes. We're able to secure some holiday food boxes for November and December. And for each holiday, we're able to secure 1,000 food boxes, and we served 17 communities the first time around. And then the second time for the holiday food boxes, we were able to serve 19 households. And with the direct relief program, the isolation assistance kits, in September of 2021, that's when we launched our direct relief program. For 2021, all the way up to until December 31st, we're able to serve 413 households, and 85 of those, we're able to serve 85 communities. And as you can see, I'm not really sure if you guys can see my screen at the bottom, but it just shows how many Hopi households were served, the number of communities, and then also with the Navajo households, we're able to serve 406, and with 81 households total, or 81 communities, I'm sorry. And then for 2022, from January 1st to present today, our teams have served a total of 1,519 households, serving 105 communities. And then the breakdown with the Hopi households, we're able to serve 74 of those, and serving all 9 communities. And then also with the Navajo Nation households, we're able to serve 1,445 with the 96 communities. And let's see here. And so just doing like the overall 2021 and 2022 numbers for the kinship care packages and the direct relief program, we come to a total of 32,615. And then the total communities served is 119. So, it's been a successful initiative for us. We're able to serve all 110 chapters, and then also all 9 villages. Let's see here. And then the next program is the Clean Hands Project, but I could share that later. Would you like me to share that now, Ethel?
That was great. Thanks, Mary.
Okay, all right. Okay, so we, in the year 2021, last year, we started phase 3 of the Clean Hands Project. That started October 20th, and we ended the second week of February, and we're able to serve 246 households with 21 communities served. And then presently, we have 75 hand washing stations, and our teams are working on serving the following 8 communities: Cameron, Chinle, Saley, Denahotso, and so forth. You see Dilcon, Loop, Navajo Mountain, and Shanto. So that is our current initiative. And so that brings our total households served. I'm sorry, hold on. That brings our total household served for the hand washing stations to 321 hand washing stations that we're able to provide to homes with no running water. And our teams are just doing amazing, reaching families that really need help in getting some of these items to, make things easier for them. So these are some pictures of our teams throughout the year, last year, and then this year. Everybody's just phenomenal. So proud of everybody. Everybody's just, all the team members are always going above and beyond. And I'm so thankful to, work with teams that are just phenomenal. So thank you guys very much. And that concludes my presentation.
Great, thanks so much, Mary. Cassandra, do you want to share about the PPE program?
Yeah, I would be happy to. So kind of how I want to go about presenting this information is I want to go ahead and share some slides with you as we speak today. So let me go ahead and get screen sharing access. Okay, are you guys able to see my screen?
Yes, we are.
Okay, wonderful. Okay, so over the last 2 years, we've been obviously doing this work pretty invigorating. We've had to get really creative, very innovative, in times of crisis, in times of an emergency. What happened, as we all know, and what we witnessed was an increase in demand for essential items, not only nationally, but internationally. And we all observed kind of a break in our supply chain in terms of being able to meet that demand. In our communities, specifically on Navajo and Hopi, having a certain socioeconomic status and challenges where we only have access to a handful of grocery stores, very limited in access to hospitals, things like that. The disparities are only exacerbated with the crisis and the emergency that was happening across the world. And what this meant was a lot of challenges for accessibility to our communities on Navajo and Hopi in terms of being able to get PPE, in terms of being able to be on the food supply chain radar and making sure that we had essential items that we needed, because there was such a huge demand and flux for a lot of food items and essential items. So we were grappling with access to these things. And so very quickly we had to come up with a way to make sure that we were cognizant of that we were making sure that we got PPE and life-saving essential items to our community members. And as part of that strategy and approach, we decided to develop a PPE distribution program. We started this program back in 2020, and we wanted to quickly deploy this PPE as quickly as we could to help stop the spread of COVID-19 and help provide those life-saving items to our most vulnerable community members, to our frontline responders, to our elders, to struggling families. And we had to really look into how to do this. So what we did is we established a relationship with vendors. We were calling around trying to see who provided this PPE, how much it would cost, did they have enough supply to meet our demands, and what would a relationship like that look like? Who could get us the best option in packages, services, who could meet the demands of our needs. We looked at multiple suppliers and vendors. We had a preference for working with Indigenous owned companies that were providing PPE. And we happened to come across a company called Sovereign Partners. And this company was able to meet the scale of items and supplies that we needed as quickly and as conveniently as possible. They were very easy to work with. And from that point on, we had established that that was the best route to go after we explored multiple options of suppliers. From there on, we took a look at our needs, assessed the needs in our communities across the Navajo chapters, across the villages. And we said we need to be able to deploy these resources and PPE as safely as possible. So we developed a protocol, a process, a procedure, training mechanisms to make sure that these items were distributed safely through no contact as much as possible, making sure that these items are sanitized and delivered to our recipients as safely as we possibly could. So what that entailed was doing a lot of training, developing policy and procedure around what this process looked like, hosting virtual trainings for anybody who wanted to do this work with us, to partner with us, who wanted to host distributions. So we decided that to move these resources, not only do we train volunteers and whoever wanted to do this work with us to get these items out, but we also wanted to do it through multiple distributions. So what those distributions looked like were mobile distributions wherein we could post up in a geographical area across Navajo or Hopi and hand out these resources safely through our own vehicles, the mobile vans that we purchased. And then also we did public distributions wherein we would find a space out in the community, whether it be a parking lot, whether it a dirt parking lot in a chapter house or a parking lot at a grocery store, where we partnered with the grocery supply chain bashes on Navajo Nation to be able to do 1 to 2 lanes of traffic of distributions where we would put the kits into the vehicles and then keep track of the data around how these resources were allocated. Other times we would do home deliveries to our recipients for those who didn't have transportation, for immunocompromised. Immunocompromised populations were high priority for us. There is a lot of folks who are wheelchair bound. They're not able to get to these public distributions. So we really made it a point to go to their homes and do home deliveries where we would put these PPE kits onto the porch through a no contact delivery system. So those were just kind of a lot of logistics distributions, things that we had to work through. So in the photos here, photographs, you see myself, Colin Sosi and Walton Sosi. These are some very key community leaders that made the logistics and the distribution all very possible. So these 2 leaders here really helped us in terms of being able to find the space between warehouses and housing these items, keeping them safe and protected, and then also moving these resources quickly. They are well connected in their communities. They have a large network. They are very empowering of young leadership. And so they would bring on a lot of young leaders in the community and give them the opportunity to help do this work with us through AmeriCorps. They have a strong sense of diversifying partnerships there with their leadership at the Chinle chapter and their staff. So AmeriCorps and youth. This is a group of us, our young leaders, that help do this work across moving these life-saving essential items. As you can see pictured here, I've never met a group of young leaders who had so much rigor and energy and passion to help save and protect community members. This is just a little bit of background on what this looked like behind the scenes. So these young leaders would assemble the masks, 3-ply masks, which we were providing all our kits, disinfectant wipes, sanitizers, and they would spend countless hours putting these kits together. As you can see, they're double masked here. They have gloves on, just following safety protocol, which was very inherent important. And then here they had their stations. We had a whole system and assembly line of how we did these things. And so they would just do this all day long, put the kits together for our relatives. And we even figured out how to move pallets, repalletize large masses of PPE in these warehouses, which the Chinle chapter was kind enough to let us use this space. We would stack these items. The young leaders there knew how to operate forklifts and tractors and move these pallets around. It was a huge challenge moving these things logistically. And so they would put these kits together there in Chinle. And this is kind of what it would look like. Here are these packages that included various masks of KN95, 3-ply masks, disinfectant spray, hand sanitizer. We were also putting oximeters, batteries, digital thermometers into these PPE kits at one point for isolation, our isolation program. And then in our regular PPE kits, we would always try to make sure that we had some form of mask supply, disinfectant, and sanitizer in each one of these kits. We had purchased a fleet of vehicles to move these resources around, pictured here. Here's some more photos of some of our staff who really got these resources out to the community from the warehouse, from the assembly, and then our team on the ground was on the front lines, moving these resources out to the public through various distribution methods. So yeah, we got really strategic in this work. And just to give you a sense of what these numbers look like, in 2020, we were able to host 59 public PPE distributions across Navajo and Hopi. And then in 2021, we were able to, in the beginning of the year, between January and August, we were able to deliver 117,000, over 117,000 PPE kits. So through 307 distributions across Navajo and Hopi. We had been able to reach most chapter houses on Navajo, and then also all of the villages in some instances on Hopi, and in some instances on multiple occasions, and some chapters on multiple occasions. So what this looked like in terms of masks, we've been able to provide over the course of the last 2 years, 120,000 PPE kits. And I would say estimating approximately 10 to 11 million masks that we've been able to get out to Navajo and Hopi communities over the last 2 years. And then as far as the end of last year, we were also providing support to provide the PPE for the isolation program. We did holiday distributions. We made it a point to get to senior centers. For the holiday distributions, we made sure we provided PPE in the food boxes with over 1,900 kits of PPE provided there. And then in the senior centers, we were able to get PPE kits to 13 senior centers, 926 kits that included KN95s, oximeters, thermometers, and sanitizer disinfectant wipe to our seniors centers. And then I know we were only going over the last 2 years, but this year we are bringing the heat. We already did over 60 distributions this year alone, public distributions across Navajo and Hopi. We also have already delivered thousands and thousands of PPE kits to chapter houses, to schools, and we're also working towards helping some of the hospitals as well as more senior centers. And this is a great time because the B2 variant of Omicron is spreading, so it's perfect time to get these PPE kits out to the community. But I have spent quite a bit of time talking. There's more to this because I didn't even touch base on the isolation kits with the PPE that was involved there. But this has just been quite the invigorating program. I really enjoy having kind of heading up this program. It's been saving lives, protecting lives, and our team on the ground has been phenomenal and really showing up in great ways. And I would dare say that in the last year, we even had more fierceness and more strength in our approach. Just when we felt like we were getting tired and we were wavering a little bit in terms of feeling exhausted being on a fire drill every day, our team just showed up even more and even harder, and they gave so much more energy and strength to this work. So I just really want to express appreciation to all of our staff and our team members, our partners, our donors. Just really grateful for all of you. And so, okay, I'll stop talking now. That's just a little glimpse and a high level overview of the PPE program.
And Cassandra, you mentioned that over the course of 2 years, we've provided over 120,000 PPE kits. But when you add the children's PPE kits to that, I think that gets us closer to 130,000, right?
Mm-hmm.
I just wanted to mention that we also had done children PPE kits in addition to the adult kits.
Yeah.
Awesome.
Yeah. Thank you.
Okay, and then so we want to also talk a little bit about our work to proactively prevent the spread of COVID through promoting vaccines and sharing public health information so people were equipped with the knowledge that they needed, as well as the tools in order to prevent the spread and keep our communities safe. So I want to give some time to Wendy to share about our public health education program and our vaccination campaign. And, you know, over the last 2 years, it would be great, but yeah, thanks so much.
Okay. Well, again, I think we're still in the morning. So good morning, everyone. And thank you for just giving some of the programs a glimpse to our viewers, as behind the curtains, it's a lot of work. And I've seen the ladies and everyone else doing so much. So just want to put my hands up for everyone and sharing. Thank you for all the good work. And as Ethel said, we have a vaccine campaign, and this has started with the grant that began in August to the end of March, as we have been granted twice. So this has really helped us fulfill a need of making sure we understand everything we can know about vaccinations, and especially here on the Navajo Nation. And I think we always have to take a step back in ways of understanding the landscape. We're working with a landscape of 4 states, and we're working with tribal communities that we have basically are at the same point of understanding everything that is coming down with COVID. If we hear about a variant, we all try to understand what is a variant, to understanding what is a booster. And so we have been on the same timeline with everyone else in really trying to make what is all this about. And so with the group working in programs of helping aid a lot of people in needs of food and resources and protection, we looked on this other side of, well, we need to definitely be right up front with helping spread the word about vaccinations. And with vaccinations, as we have learned at the beginning, it was very tremendous to have one for COVID-19. And we saw the long lines, and we saw the need of everyone trying to get the first shot. And luckily, you know, for those, I live close to a border town, so I was able to get like access to understand where sites are at. But when you have to look down to like, you know, those who are very remote and rural, where do they get the access? And at the time where, how is transportation going to happen to, what are the hours that is offered? Because it's a long ways to drive to clinics and to know, is the availability there for everybody? And so we placed an outreach campaign to give education to the vaccinations, to the shots that are available with the clinics around us, and also with the current needs of boosters and the new demographics that it started to reach to, because we knew it was, you know, a place for our elders and immunocompromised, and then it went to our adults, and then it went to young children. And as we're still waiting for the next area of kids under 5, but all this is in areas of what we keep sharing, protect community, and placing this shield around us. Because being on the reservation, knowing you have to drive to get food, drive to get to your doctor, drive to get wood, coal, what needs of heating your home for the winter. We try to keep continuing the conversation of all the updates we're able to gather with things of the vaccination. And ways of helping this is the outreach we were able to do with many creative areas. And a lot have started when I jumped on in March, but a lot have definitely continued to progress in ways that I feel people recognize such items, and to keep ourselves current with the public and sharing. We are here for you. We're learning everything as we can. We're sharing information we have, and creating such communication channels. And so I want to share a couple of slides with you to kind of go over what has been happening since August. And so I will go ahead and move to the slides here. So let us move down to the second slide, please. Okay. So on the second slide, these are areas of our incentives that we were able to help place in areas of increase in our vaccination awareness. And so some incentives included the bumper stickers on the top, to banners that were posted around our community, border towns, and we have influencer flyers of just influencers that did take time to share their story of being vaccinated or boosted. And there was one pagers which helped give information to really critical areas that we all needed to understand, like just the basics of hand washing. How big has this become since we know COVID entered our towns? Just kind of like, washing really simple to really making sure we wash in the most effective way, as we know that's still a great strength in combating COVID. And you can see on the left-hand side is a one pager that is talking about the variant. So understanding COVID is just not just COVID. We saw multiple sections of COVID changing, and these were through the variants. And one of the big ones that came forward was the Delta, and trying to kind of share in a way of what is this about? How is it the same or different? Is there ways that we have to do things in protective measures? And so this was done with this one pager. And we relate it to the landscape again of our culture and ways of looking at what we're familiar with. I mean, we have been a culture of just always being together and celebrating and being outside, and part of that is like going to flea markets or going to rodeos, and so a lot of these were with a lot of thought of placing that familiarity to our public, of just sharing, these spaces, we got to really think again now, and we got to be careful, and just reiterating such proactive measures of the masking, placing the mask on. And so we had a lot of one pagers that were developed in ways of just sharing such information that were very vital, and to see that evolve as far as what we have learned with the pandemic. And so, and the last little picture on the right hand side is looking at a gift card. And so that was an incentive we were able to have to share with our participants who are vaccinated and boosted. And so these were just measures, again, saying rewarding our community. They took the initiative to get their shots. And that's just the way we have to begin such protectiveness of a shield around our community. And so we are definitely very grateful for everyone who has participated, who received incentives. It was nice way in the beginning when I saw some of these one pagers like being posted on the walls, like when I went to like a business center, and it just shows how much we want to keep helping one another. And so these were some of the tools we were able to help share with that. And next slide, please. So here are some pictures of our teams. So a part of us understanding where COVID has gone, we definitely watched the cases of when things were low to things that were high. And when we had cases that were low, we still wanted to share with the outreach of information. And so we did a lot of outdoor tabling. And so in this way, we were being very safe and safety measures of social distance, masking. But in that sense, we were able to, again, have such incentives displayed and for people to win. We had a nice colorful wheel, and it was just, just like, oh, you can see us at the flea market and you come over and what's this about? And then that's our conversation piece to talk about vaccinations, talk about what the variants are. But as we know, we started to get high cases, and so we did move on to phone banking. And phone banking, we had our team members have people that signed up that wanted to hear more about the program, and we outreach to them, and such incentives were able to be sent. And one of the incentives, as you see in the middle picture, is a t-shirt, and it has a great picture made by OXDX, and it has a young couple, an elder, and a young child all together and encircled with a heart, and a bandage that encircles a vaccination as a heart. And so it's just going to be amazing to see in time when we look back just how everyone came together and how much symbols we're able to use in sharing how we came together in this time of the pandemic. And so I really love this picture of that t-shirt, because to me that's always going to stand very strong. Next picture, please. Okay, so this is just a general graph. We can just kind of share with the months as we had the grant, the outreach we were able to have with incentives, and the people we're able to reach. And so you can see that the graph does definitely have its highs, had its lows. In a lot of ways, when we really tracked how cases were going nationally to even throughout the Navajo Nation, you can kind of see, like in the fall time when cases were a little bit low, I think people were generally trying to understand what things are at right at the moment. And when variants spiked up and people were kind of a little bit held back, but then again, came out to want to learn a bit more. And so it's very interesting to see the relationships that happen with the caseload as going on nationally and on the Navajo Nation, to the variant cases going on nationally in Navajo Nation, and to the vaccination rates as we help look at the demographics of, looking at 20 to 40-year-olds and their vaccination rates, along with the young children, where they're at with their vaccination rates. So again, it just places that understanding of communication to share more about vaccination and education that goes with it. Next slide, please. I think that's it. Okay, so overall, I'm just very amazed again at the team that we're able to see on a daily basis, and the work that was placed in all capacities. I never saw a moment of anyone just not doing over 1,000% of themselves. And to our team members that make up just the core of us, which is all around us in the reservation. So our shout out to Amanda, Hector, Walinda, Relisha, let's see here, Mahayo, Mateo, Jose, to our Gallup team, Pat, Christian, 491 team, Danae, and to just everyone that's helped, like Lorraine, Sterling, and Mark. And so there's just a multiple of great people that help make this pull forward and push strong because it's been challenging. One, the terminology, two, how fast everything evolved, and just us making sure that we were definitely helping our people as much as we can. And so it's just a little bit of a snip of looking at the vaccination campaign. And so again, want to thank everyone for your time.
Wonderful. Well, thank you so much, Wendy. I always love hearing about our vaccine program because that's kind of like the proactive thing. Like, never want to just be reacting to a challenge. And I just love that you guys are able to mobilize and get that out there. And the really cool thing is we've spoken to like over 700 folks who've participated in our public health program. And most of those people were vaccinated. I mean, I think it's only like 5% or so that were not vaccinated. So, that's, I don't know if that's truly reflective of the numbers. I mean, we have the numbers that are coming from the Department of Health. But I mean, what we've seen is just like amazing courage and leadership from everyone that we've spoken to who, and they're all inspired by wanting to protect our community, protect our elders. And it's just so beautiful to hear those stories. So thank you, Wendy, for your work and your team's work and connecting with those folks and thanking them for what they've done by providing them with incentives. Really love that we're able to do that. Okay, well, we're going to hand things over to Shondine, and she's going to share with us some performance outcomes for our community center, which has been very exciting. We've only had that in operation for 9 months now, but it has been very high performing. So Shondine, it's all you.
Great, thanks, Ethel. Yeah, we opened our community center in August, so we're a few months into this, and it's been really incredible to see how quickly people were able to become familiar with our space. So here is the Savinza Community Center in Monument Valley, so we're located at the Welcome Center there. And our most popular space is our business center. And so in terms of like visitations, we see a lot of people who come to the community center primarily for, the business center access and the resources we have there. Since we opened, we've had over 1,000 visitations from 423 unique visitors. So, with that, 40% of our visitors come specifically to the business center. So to get on the computer, in this photo, you see one of our computer literacy classes. So we do offer support for community members who just want to learn more about utilizing the internet or using, capabilities like printing and faxing. So we offer that there, but we see a really high need for this kind of support. So we're able to kind of support community members who come in that way. And so if you look at kind of the breakdown in terms of our visitors, like I said, it's over 70% come to the business center. And then we also offer classes. So we have classes where we're teaching folks how to quilt and then how to bead. So in this photo, you see one of our youngest participant, our 3-year-old Rainy, who came to some of our sewing classes. And so again, it's just a really fun opportunity to create a community space. I think for rural communities like Monument Valley, we don't necessarily have anything like this really. And I think that's why it's become so popular. But in addition to that, we meet twice a week in the evening, just creating that space. And on a personal level, I think it's just really a great time for community members to come together, especially, after COVID and people being so isolated and not having that time to just convene. And I think that's such a huge part of our culture and our community. So we definitely see people taking advantage of that. And so we also do beading classes. Here's some of the projects participants have worked on. And it's really, my favorite part is seeing people learn a new skill and are really proud of the product they created. And what I also think we're really proud of at the center is just where the center is situated. So we, serve people from the Monument Valley community, Ojeto community, and Halchita. So if you look at the population size, according to the 2020 census, that's actually just over 1,000 people. So 1,070 people. And so far, we've served over 400. So we've been able to serve nearly 40% of the combined population in the Monument Valley area in the 7 months that we've been open. So, I think that number will continue to grow. And another reason it's become kind of just like this community hub is because we don't have a public library, and we actually don't even have a chapter house like most communities do. So there's really no like physical place for people to access information or different resources. So we've kind of become that community hub. And, I think my favorite part is when people come for the first time and we're able to give them a tour and, learn of the resources. One of the biggest questions we get is, this is great. Like, how much is it? Is it free? Like, how do we kind of engage with this new facility? And we're always, really happy to let them know that everything here is free. It's for the community use. And so just to kind of see them feel included in that way where they're not having to kind of pay for something or try and gain access to it, like it's there for them, I think is a really big part in how we're able to show up for our people. Lastly, people are able to save money. And I mean, we've all seen the gas prices skyrocket, but what's so common in our community is people traveling far distances. So a lot of people in our community travel to Blanding, Utah, to the public library, to fax paperwork, to get on the computer, things like that. And that's 70 miles from Monument Valley. So we're helping people stay local. We're helping them, save money by preventing these long trips when they can just come to the community center. This last picture here is a tour we did with some college students from Utah Valley last week. So in addition to providing that direct resources, we are seeing a lot more people learn about the work we're doing and come and see, how they could potentially, replicate this in their community too. So I think that's also an important part of our work, is just continuing to share what we're doing and helping others do the same in their community. But I'll go ahead and stop there. It's just really exciting to kind of see how the community center was able to, how we were able to kind of get it off the ground quickly and then see the response it's had so far in our community.
Okay, awesome. Thanks so much, Shandine. It's so exciting to see how much the response has been from the community, and I'm excited for that day when 100% of community members will have visited our community center. And just super excited. I mean, Shandine has some really great testimony from visitors on our website or our webpage for the program, as well as the Facebook page. Of course, the Facebook page is always full of more information, more real-time products. But there are like business people who are sharing their stories of how much the community center has had an impact on their lives and helped their businesses. That's what that's about, rebuilding. We took the lessons from our COVID response and our experience during the pandemic, and we fed that into the design of this community center, trying to build stronger communities, making sure that disruptions in larger supply chain systems don't impact our people in a negative way by rebuilding the strong local economies that we had 100 years ago. So really excited to see those outcomes as we continue to track that going forward. And I also just wanted to give everyone, I know we started a little bit late and we have another panel starting, but if you don't mind, please, each of you share some parting words with our listeners. You guys have reported on some really amazing performance metrics, and maybe share some thoughts on that. I mean, it's always fun to do these reflections, it's like astounding to see the productivity of the team. So Cassandra, we'll start with you and move to Mary.
Yeah, so born and raised on the Navajo Nation by a bunch of strong women like my grandma And my mom, my mom is a single parent of 6 children. I grew up without running water and electricity and some really challenging circumstances. But just being around my family and the women, seeing how strong they were in terms of being resourceful and providing a livelihood for us, I felt in retrospect that this is actually a really rich way of an upbringing, just really to take care of family and community and to be resourceful. So it's an honor for me because a lot of our families on Navajo, a lot of our relatives are hard workers and very resourceful, trying to sustain our culture, trying to take care of our younger generations and make change, positive change. And this is with many different organizers across Navajo and Hopi and leaders, community members, really trying to do this work to help sustain our culture and our livelihood as Indigenous, Diné, and Hopi peoples. So it's an honor for me to give back, to use the resourcefulness that was taught to me, the importance of family, the importance of community and giving back. So it just feels natural to be in this role. Really grateful for the opportunity to do this with many other visionaries like you amazing matriarchs and many of our community members. So just really grateful for that.
Mary?
Okay, I just want to say thank you for, just being here today with us, listening to our updates, having an interest in that and just supporting us all the way around. It's been a very difficult journey for everyone, for, the families that have gone through COVID. Some of the families are still feeling the effects of it, and our work is not, it's not done here. There's so many different projects, in mind, long-term sustainability, all of that, so this is just the beginning. And so the COVID response is, just a short-term way for us to respond to the communities. There is a great need for it. So just continue practicing safety precautions and, masking up, get fully vaccinated. And then that's what I have. Earlier I was sharing some information. I'm not really sure. Would you like me to share that information, Ethel, or is that something? Okay. All right. So yeah, so I just wanted to share those closing remarks, and I continue joining us throughout the day. We do have some different sessions scheduled for to share with you a lot of the information that information about the programs, information about all our partnerships and everybody that's making the programs, making the Navajo and Hopi families COVID-19 relief fund efforts happen. So yeah.
Great. Well, thanks so much, Mary. Wendy, any parting comments?
Yeah, hi again. Well, as we have learned, it's taken a lot of work to be in an area that we want to continue our people to be safe and protected. And as we have heard, just the resiliency that we carry and that we can move forward with such great strength that we continue to be here and to continue for the future generations to all share the beauty that we have and feel with our culture. And just in modern ways, looking at how vaccines work, as we know with COVID, it's one shot is not it. A second shot gives you a bit more time to be safe, and a booster definitely helps keep us on top of everything, including the variants that come down the line. So keep an eye on future happenings as we continue to live in this pandemic world, and share with your loved ones, because as we know, we can't see this virus, and thus the ways of masking, the ways of washing our hands, the ways of social distancing are still very important proactive measures. And maybe when you have time to visit a clinic, just for normal medical reasons, ask them about what they have with some of the therapeutics that they have, and just in ways of just understanding you can share that information with your family, and continue on to just be proactive in your health. And I think that's what we all learned, how important that is. So yeah, and thank you.
Wonderful. Thank you so much, Wendy. Shadeen, parting comments?
Well, I don't really have a lot to add to all of that, other than just saying that, I'm always really proud of all the work you all are doing, that we've been able to do over the past couple years now as an organization, and just excited to continue to see, our work expand into more communities. So ahead to all of you for your continued support.
Wonderful. Well, thank you so much, Shadeen. Really cool that you've had that evolving role in the organization, and experience all of our different iterations so fully. But we're done with our panel. Thank you everyone for joining. Thank you so much for your comments. Thank you to this phenomenal team of women leaders who are just doing really amazing work. And this is not easy work. And these women are working incredible hours, incredibly hard, every single day to make sure our community is safe. So I want to thank you, ladies, for all of what you bring to your work every single day. So Hakona and Ahiha, and we'll talk to you guys soon. Please join our next panel, Tales from the Front Line.
Yeah, it's a good one.
Hakona.